Hi everybody and welcome back to another English lesson. When I left you yesterday, Sir Gadabout and Zog were making some not very good choices. They were talking about having a fight. And I'm really pleased that you wrote some lovely postcards and some lovely letters that really helped them make the right choice. Help them think about how they were feeling and how to get out of that red zone and to make some better choices. Thank goodness. So let's find out what happened in the story when we left them. It said that who was going to win the fight? Sir Gadabout or Zog? The Princess Pearl stepped forward, crying, "Stop, you silly chumps! The world's already too full of cuts and burns and bumps. Don't rescue me! I won't go back to being a princess and prancing round the palace in a silly, frilly dress. I want to be a doctor and travel here and there, listening to people's chats and giving them my care." "Me too!" exclaimed the knight, and he took his helmet off his head. "I'd rather wear a nice twisty stethoscope," he said. "Perhaps, Princess, you'll train me up." And Pearl replied, "Of course. But I don't see how the two of us can fit upon your horse." Then Zog said, "Flying doctors, I'd love to join the crew. If you'd let me be your ambulance, then I could carry you." "Bravo," said Madam Dragon. "Excellent career." And all the Year 5 dragons gave a loud, resounding cheer. Then Madam Dragon told the horse, "I really hope you'll stay. I'll let you be my people's pet and feed you lots of hay." "What a good idea," said Zog. Then up and off they flew, the flying doctors waving as they zigzagged through the blue. And that's it. Zog and Princess Pearl and Sir Gadabout have gone off to be doctors. Now, we know that is a really important job, especially at the moment. We know that the doctors and nurses and all the NHS staff are working really, really hard in the doctor's surgeries and the hospitals to keep everybody safe and well. So I thought today would be a really great day for us to become doctors too. So I'm wearing a very different outfit today because I am going to use my imagination to become a doctor with you too. So let me show you what I was thinking we could do. So here's Zog and Princess Pearl and Sir Gadabout. And here's some real doctors busy at their jobs. Today, you are going to make your own doctor surgery. That's right. At school, if you're at school learning, or at home, if you're home learning, you're going to make your own doctor surgery so you can be a doctor too. So what you need to do is set up your doctor surgery. You need to think about what you are going to need. And also you're going to have to make signs to go up in your doctor surgery to show everybody what things are and where to go. So I put some pictures to help you and give you some ideas. So the first picture here is the outside of the doctor's surgery, and it's got its name. It says Townfield Doctor's Surgery. So Princess Pearl, Sir Gadabout and Zog, when they were creating their doctor surgery, they're the flying doctors. So they might call it the Flying Doctor Surgery. What will your doctor surgery be called? Make a sign and put it up so everybody knows. You will also need a little waiting room because doctors get very, very busy. So you have to wait somewhere until it's your turn to go in. So here is where they wait. Can you see that? The waiting room. And in the waiting room, they have posters. They have posters telling people how to keep safe and things to do. Now, we know we've been learning a lot about keeping safe at the moment, especially with this horrible virus. We know we've been thinking about washing our hands for at least 20 seconds and singing happy birthday twice. You might make a poster to remind your patients about that. You might make a poster to keep them on about keeping a distance. We've been thinking about keeping a safe distance from people when they're not in our bubble, when they're in our family. So you might make a poster to remind them about that. You might make them a poster to remind them to get their vaccinations, so those injections that stop them getting poorly, or something different. They also have lots of good books in a doctor's surgery. So you've got something to read to keep you amused. So you might want to collect up some of your favourite books for your patients to use while they're waiting for you. Or you might even want to make your own little book that they can read to keep them amused. You also need some signs to tell you who the doctors are in your doctor's surgery. So here are some signs here. They say the doctor's names. Can you see them? So if I was going to be a doctor, I might be Dr. Brown, because the doctors often use their surname. So you might want to use your surname, or you might want to use something different. But some signs say who works in your doctor's surgery. They also have somewhere where they answer the phone. This is the reception, okay, at the hospital. A bit like we have the office at school. And the people who work in the reception, they have to answer the phone, and they have to say, what is wrong with you? They make a little note of what the person says is wrong with them. And they give them a time and a day to come and see the doctor. It's called an appointment. So you need to write down what they say and write down when their appointment is. So that would be in your waiting room. You've also got the doctor's surgeries here. So there's a doctor working here with his patient and a doctor working here with her patient. So you might want to set up, they've both got a computer. Might want to make yourself a pretend computer you can type on. You need pens and paper so you can write down what the patient says to you and what you notice about them. Write down what is wrong with them and how they need treatment, what they need to do to get better. You might want to make some special things like stethoscopes so you can hear their heart, maybe with some junk modelling or something similar. Okay, but these are the doctor's surgery, so you can set up a little place for you to sit and talk to your patients. Over here is another one that somebody else has made up, so you can see their signs, you can see their pens and paper for writing their notes, their books, you can see their stethoscope. They've even got a special little outfit to wear. You might want to put something different on today while you're a doctor. You've got some different things. There's an eye test chart, a little bed for them to lay down if you need to check them over. So you need to think about, what does your doctor's surgery need, and some signs so people know where to go. Then you get to be a doctor. Very exciting. So what do you do if you are a doctor? Well, you need to answer the phone, make those notes. So here's some telephone messages. Write down who phones, what is wrong with them, how important it is. Is it really important? Do they need to see a doctor now, or can they wait a little while? You need to know a day and a time that they're going to come and see the doctor. So who it is, what's wrong with them, and when they need to come and see the doctor. You need to examine your patients. You might have some human people that can be your patients, or you might need some toys that can be your patients. So you look at your patient and you ask them what's wrong with them, and you write down what they say. So over here are some forms. So you might want to write down where the problem is. So there's a picture of a person. You can draw where the problem is. You need to ask them, how painful is it? Out of 10 to 1 on the scale, how painful is it? 10 is it's really, really painful. I can't bear it. 1 is it's a little bit painful, but it's not too bad. You need to write down their name. You might how old they are. That's really important, so they know how to treat them. You might want to say anything they've done before to try and make it better, how they did it, and what it looks like, what their injury is. Is it a cut or a bruise or a graze? Is there a lump? What is it? You'll need to write them a prescription. Doctors write prescriptions. That's what medicine they need to get better. You give that to the pharmacist, okay? And the pharmacist finds the right medicine. You need to write it very carefully so they don't make a mistake. So do they need some bandages or some plasters? Do they need some cream or an inhaler or something different? Tablets, medicine that they can drink. Think about what they need to get better. And you might need to write some instructions for your patient, how they use it. So how often to put the cream on, where to put it, when to do it, those sorts of things. And you might also be a very kind doctor and want to make some get well cards for your patients to say, I hope you feel better soon. Now, some important writing skills to remember when you are a doctor today, because doctors are very important people. You need to make sure that when you're writing, you sound out your words carefully. Look at that awesome orange for sounding out. Some medical words are very tricky to spell. Don't worry too much if they're not spelled right, but do think about sounding that. Have you used the sounds you know and somebody else can sound it out and work out what you mean? Use very neat handwriting so people know what the doctor is asking them to do. Or if you're the pharmacist and you're given the prescription, you can read what it says and make sure you're giving the right medicine. Otherwise, that would be a bit of a disaster. So very neat handwriting, carefully sounds out words. Write in full sentences so people know what is happening to them. You can't just write cut medicine. That doesn't help them. So you need to write, they have a cut and what they do. So you need to take this medicine or put this cream on this many times a day. Remember you need a capital letter at the start of a sentence and a full stop at the end. I've got some challenges for you. Very good doctors would use adjectives. They'd use adjectives because they describe exactly what's wrong with them. They won't just write, it is a cut. They'll write, it is a huge cut or a small cut. Or they'll say, it is a small cut with red around the outside. Or they might say, it's a huge cut with a big hole in the middle and dark outside, or something different. So you need to explain what it's like. Also, if you're a very good doctor, you'll use conjunctions because you're telling your person how to look after themselves. So you might say to them, you have a large red cut. And you need to put on cream 3 times a day because this will make it heal. Or you might say, you have a sore ear. You need to apply ear drops so the swelling will go down, but make sure that it doesn't run down your ear. It goes inside. Give them some more information so they can look after themselves properly. Anyway, I know you are going to be fantastic doctors because you are all really caring. So I cannot wait to see what your doctor's surgeries look like and what you got up to. Have a lovely day and I'll see you all tomorrow. Take care. Bye-bye.